Did you know that 70% of men over 60 experience some issue related to sexual health, but only 20% seek medical advice about it? That's right, folks. And the most surprising thing is that many of the discomforts that affect quality of life in the golden years could be alleviated or even prevented with a simple, natural, and pleasurable habit that many abandon as they get older. We're talking about something our bodies were programmed to do regularly, but which, due to embarrassment, lack of information, or even believing in old wives' tales, many men set aside precisely when they need it. You've probably already guessed it. I'm talking about regular ejaculation, that subject that's often treated as taboo, but which can be one of your greatest health allies after 60. Today I'm going to reveal how the frequency of this natural act can directly influence your quality of life, mood, sleep, and even the health of your prostate. And the best part? I'm going to show you that this doesn't depend on whether you have a partner, can maintain firm erections, or are even taking medication for chronic conditions. I'm Dr. Alexander King, your partner on the journey to a full life at all ages. Let's start with a truth that modern medicine increasingly confirms. Ejaculating regularly can be one of the best exercises for prostate health. A study conducted by Harvard Medical School followed over 30,000 men for nearly 2 decades and discovered something remarkable. Those who ejaculated an average of 21 times per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times in the same period. But how exactly does this work? Think of the prostate as a small factory that produces part of the seminal fluid. When you go long periods without ejaculating, this gland becomes congested, like a plumbing system that's rarely used. Stagnant prostatic fluid can become a breeding ground for inflammation and even for the development of abnormals. Each time this system is completely flushed and renewed. It's like flushing a system that needs movement to. Regular ejaculation helps eliminate potentially carcinogenic substances that can accumulate in the prostate ducts over time. And that's not all. During ejaculation, a series of muscle contractions occur that function as a natural massage for the prostate. These contractions help maintain muscle tone in the region and improve local blood circulation, contributing to the overall health of the organ. Have you ever felt any discomfort in the pelvic region after spending too much time without sexual activity? This discomfort may be a sign that your prostate needs this natural exercise. Now, a common question. Doctor, I take medication for my prostate. Should I still worry about this? Yes, my friend. Medications for benign prostatic hyperplasia, the benign growth of the prostate, help reduce symptoms, but regular ejaculation works on another front, complementing medical treatment. It's like taking care of a plant. The medicine would be the water, and regular ejaculation would be the pruning needed to stimulate healthy growth. When we talk about ejaculation, we're not just talking about a mechanical act or a momentary relief. We're talking about a true chemical revolution that happens in your body and that has profound impact on your overall well-being. During orgasm and ejaculation, your brain releases a veritable cascade of substances that are essential for your mental health: endorphins, oxytocin, serotonin, and dopamine. It's a natural cocktail of well-being that no medication can reproduce with the same effectiveness and without side effects. Oxytocin, for example, known as the love hormone, not only provides that feeling of relaxation and connection after orgasm, but also has proven anti-inflammatory properties. For men over 60, who often deal with chronic inflammatory processes in various parts of the body, this is an invaluable benefit. Dopamine, the neurotransmitter of pleasure and reward, plays a crucial role in combating depression and anxiety, problems that tend to increase with age, especially after retirement or in the face of significant life changes. A curious fact: did you know that studies show that men who maintain regular sexual activity have more balanced testosterone levels, even in old age? And testosterone isn't just the hormone of libido, as many think. It's essential for maintaining muscle mass, bone density, energy, and even cognitive function. In other words, ejaculating regularly helps keep your hormone levels closer to a healthy balance. Have you ever noticed how you feel more willing and in a better mood in the days following a satisfying sexual experience? It's not a coincidence or just a psychological effect. It's your biochemistry working in your favor. And before the question arises, "Doctor, what if I can no longer get erections like I want to reassure you?" The pleasure and hormonal benefits of ejaculation do not necessarily depend on firm erections or penetration. There are techniques and approaches that allow you to achieve orgasm even with partial erections, and we will talk about. There is a dimension of regular ejaculation that goes far beyond the physical, and that may be even more important after the impact on your self-esteem and how you see your own masculinity. Many men, when they notice the natural changes that occur with age, such as decreased sexual desire, erection difficulties, or changes in ejaculation, end up developing feelings of inadequacy or even loss of identity. It's as if a fundamental part of who they are is gradually. I'm going to share a true story with the name changed. Carl, a 68-year-old patient, came to my office completely dejected. After facing prostate cancer and undergoing surgery, he had lost the ability to have firm erection. "Doctor, I no longer feel like a man," he told me, with tears in his eyes. I advised Carl to explore other forms of pleasure, including masturbation, without necessarily seeking a complete erection. 3 months later, he returned transformed. He had rediscovered his sexuality in another way, and more importantly, had regained his identity. The truth is that maintaining a connection with your sexuality, even if it's expressed in different ways throughout life, is fundamental to your emotional health. Ejaculating regularly, whether through relationships with a partner or through masturbation, is a way of affirming to yourself, "My body still works. I'm still capable of feeling pleasure. I'm still alive in every sense." And this affirmation has effects that extend far beyond the moment of pleasure. It influences how you relate to others, you present yourself socially, and even how you face everyday challenges. Have you ever caught yourself avoiding social or intimate situations due to insecurity related to your sexual ability? How do you think your life could change if you regained confidence in this area? An important point. For many men, the idea of seeking pleasure alone after a certain age may seem inappropriate or even shame. We need to demystify. Masturbation is a healthy practice at any age, recognized by doctors and sex therapists as a valid and valuable way to maintain sexual health, especially for those who don't have a regular partner or face physical limitations. Now that we understand why regular ejaculation is so important for men's health after 60, let's talk about because the truth is that every man lives a different reality. Some have stable partners, others are alone. Some maintain the ability to have erections, others face difficulties. Some are healthy, others deal with chronic conditions or the effects of surgery. For those who have a stable relationship, it's important to open a dialogue with your partner about the changes that occur with age. Often, honest communication can lead to surprising discoveries. One 65-year-old patient told me that after talking openly with her husband about his difficulties with erections, they rediscovered forms of intimacy that they had forgotten since they were young: caresses, massages, oral stimulation. And this brought a new phase of pleasure for both. For those who are without a partner, regular masturbation is the most accessible way to maintain the benefits of ejaculation. And here's a practical tip. Use water-based lubricant. As you get older, the skin becomes more sensitive and dry, and the right lubricant not only increases comfort, but also intensifies. For those who face erection defects, whether due to natural causes or resulting from medical treatments, such as prostate surgery, there are specific techniques. One of them is stimulating the penis even in a flaccid or semi-erect state, focusing on sensations and not rigidity. Many men discover, surprisingly, that it's possible to reach orgasm and ejaculate even without a complete erection. Another technique is stimulating the perineal region, that area between the scrotum and the anus, during masturbation. This area has numerous nerve endings and is close to the prostate, which can intensify pleasure and facilitate ejaculation. Light pressure in this area with circular movements can make a big difference in your experience. And for those who use medications that affect sexual function, such as some antihypertensives in this case, the tip is to experiment with different times of the day. The effect of the medications varies over the hours. Many men find it easier in the morning, when testosterone levels are naturally higher, or a few hours after taking the medication. Have you ever tried adapting your sexual practices to the changes that have happened in your body? What worked and what didn't work for you? Remember, there is no universal ideal frequency for ejaculation. The important thing is to find a rhythm that works for you and your body, respecting your needs. One of the biggest obstacles to maintaining an active sex life after 60 is not in the body, but in the mind. Our society still carries many prejudices about sexuality in the later years, and many men internalize the idea that sexual desire or the search for pleasure are things for young people. I've seen this in my office for over 25 years. Men who feel ashamed for still having sexual desires after a certain age, as if it were something inappropriate or out of place. Others who, after a few frustrating experiences, simply give up and accept a life without this essential component of human will. I'm going to share another story. Anthony, 72 years old, a widower for 5 years, came to me to treat persistent hypertension. During our conversations, I discovered that he had completely abandoned any form of sexual expression since his wife's death. Not for lack of desire, but for a mixture of grief, guilt, and the belief that, at my age, this is no longer important. I suggested that he consider resuming masturbation as part of his health care. 6 months later, not only was his blood pressure more controlled, but he reported significant improvements in sleep, mood, and even willingness to engage in social activities. The truth is that sexual desire can indeed transform with age, less urgent, reflective, more connected with emotional aspect, but that doesn't mean it should disappear. And maintaining the practice of regular ejaculation, even when spontaneous desire is less frequent, can help keep alive this circuit of pleasure and well-being. A common mental barrier is the rigid association between erection, penetration, and sexual satisfaction. Many men believe that if they can no longer have firm erections like they did at 30, then their entire sex life is compromised. This simply isn't true. Sexual pleasure, including what leads to ejaculation, can be achieved in various ways, with or without a complete erection, with or without penetration. Have you ever caught yourself thinking that this is no longer for my age? What led you to have that thought? And what do you think would change if you challenged that belief? Another important cultural barrier is the taboo surrounding male masturbation in the later years. While for young people this is seen as something natural and even expected, for older men there is an awkward silence. We need to normalize this conversation. Masturbation is not just a release valve or a substitute for real sex. It's a legitimate and healthy form of sexual expression with proven benefits for physical and mental health. We've reached the end of our conversation about a topic that, despite being natural and essential, still faces so many barriers of silence and misinformation. I sincerely hope that the information I've shared today can help you look at your sexuality after 60 with new eyes, not as something that is inevitably fading away, but as an aspect of your health that can and should be actively cared for. Let's recap the main points we discussed. First, we saw how regular ejaculation functions as a natural exercise for the prostate, helping to prevent congestion, inflammation, and even reducing the risk of cancer, as demonstrated by long-term scientific studies. Next, we explored the true biochemical revolution that happens in your body during orgasm, with the release of hormones and neurotransmitters that combat depression, reduce anxiety, improve sleep, and even strengthen your immune system. We also discussed the profound impact that maintaining a connection with your sexuality has on your self-esteem, your masculine identity, and how you relate to the world around you, an aspect often underestimated by men themselves and by healthcare. I shared practical techniques for different realities, showing that regardless of your current situation, with or without a partner, without physical limitations, there are ways to maintain the benefits of regular ejaculation in your life. And finally, we addressed the mental and cultural barriers that often prevent us from seeking this essential aspect of well-being, inviting you to question limiting beliefs about sexuality in the later years. Now, my friend, the invitation I leave you with is simple, but it can be transformative. Don't accept the decline of your sex life as inevitable. Whatever your age, your health condition, or your relationship status, you deserve and need this component of pleasure and vitality in your life. If you enjoyed this video and believe that more men need to have access to this information, please subscribe to the channel and share it with your friends, brothers, fathers, or uncles who may benefit from this knowledge. It's amazing how an honest conversation about a topic considered taboo can open doors for profound transformations in someone's life. And remember, taking care of your sexual health is not a luxury or a frivolous pursuit. It's an act of self-care as important as eating well, exercising, or controlling blood pressure. Modern medicine increasingly recognizes sexuality as an integral component of health, especially in the later years. To finish, I leave you with a thought. The youth of the body may be fleeting, but the ability to feel pleasure and connection is a gift that can accompany us throughout life, as long as we know how to cultivate it with wisdom, openness, and without the unnecessary burdens of outdated taboos. I'm Dr. Alexander King, always by your side on the journey to a full life in all its dimensions. Until the next video.